care home sector is absolutely huge. There are more nurses that work outside of the NHS than work in it. And quite often nurses in the care home sector do feel undervalued, sort of underrepresented and actually not listened to. So the RCN Foundation set this as a priority a couple of years ago, and they have funded a significant amount of work and research into this field. And today was so important because we're able to bring people together from across the care home sector to both hear from some fantastic speakers, but also to reinforce the importance that we all put on that really critical part of the nursing workforce.
So today is a culmination of several things. It's allowing people we funded to present throughout the day, but it's also bringing people together who had parallel projects which are very interesting and associate with that other work very well.
I think the biggest impact that we've seen the foundation having is the way that funding has been directed towards the research programme, so that we really start to understand the activity that goes on in nursing homes, what the nursing contribution is to that, and really from that body of evidence we can start to build a case about how important nursing is in the care home sector, and also starting to understand that the work that nurses do in those homes is a really important part of affecting the local health economy and playing a part in commissioning of services, and really how whole areas of the country start to engage with care homes and deliver better nursing care for everybody.
Our area of work is around tackling loneliness and social isolation generally, but particularly in the care home setting. It's enabled us to very quickly get our intergenerational strategy launched, launch a book that is encouraging children to get involved in social and healthcare, and to get the twinning process going between schools and colleges and care homes.
One of the things that came up today has been about the challenge of shared learning across the care home sector, and I think these kind of events are really critical to opening up the kind of work that the RCN Foundation is funding, but also how that is having an effect on different care home settings, the relationships between different sectors, and how they all help to provide better care for older people.
It is so important to bring people together, to showcase what's going on that's really great, to let people network with others so they can, have somebody that they can ring up after the event and say, you talked about this and actually that sounded really good, and what can we learn more together? So I think these sorts of events are so important.
I hope people will go away realising how easy it is to make a difference, and it doesn't need to cost a lot either, if anything. So I think that's some of the key things from today that we'll get across.
I hope that delegates will have come today, and what they'll take away from it is an acknowledgement and an understanding that we all think they do matter, that they will have learnt from the work that's been done across the United Kingdom, and that they'll take some of those nuggets of best practice, of learning, back to their organisations to share it and to spread the word, so that more and more nurses from care homes step up and say, look at what we do, we're proud of what we do, and let me talk about what we do. And I think that's something is really important.